Welcome to Have Your Say. I'm Diana Robertson, president of the NAACP Mainline Branch. And today we have as our guests two individuals from LaSalle University. One is Dr. Candace Robertson James, who is the director and assistant professor of the Masters of Public Health program, and a second-year student who is Janine Gill of the Masters of Public Health program. Welcome.
Thank you. Thank you for having us today.
So, public health, big topic. Why don't you start off by just telling us a little bit about yourself, and we'll move on from that point.
Awesome. Thank you so much for having us here today. My name is Candace Robertson James, as you said, and I really am excited about public health. I was introduced to it several years ago as I had the opportunity to work and research really exploring public health topics, and then later when I taught middle school and just really seeing it firsthand, seeing all of the other factors that influence whether the students that I worked with would have the opportunities to excel in the classroom was impacted by so many other things that we now kind of in public health call social determinants of health, and that really inspired me to go back to school to pursue a career in public health.
Okay, and Janine.
Yes, thank you for having me today. I guess my public health journey all started when I did a lot of volunteer work in undergrad, and I knew that I wanted to serve my community, and I knew public health was about really providing solutions to my communities, whether that may be mentally or physically or socially, but I didn't really know how to really do it. I knew I really liked research, and I knew I really liked medicine. And I find that public health is a good marriage of the two. Okay. So yeah, just trying to figure out how I can create equitable opportunities for my community, and that's why I really got into this grad program.
Okay, great. So when we describe public health to the average layperson, how would you describe it in general?
Well, public health has two sides. It's really about preventing disease and illness and promoting health. Part of the core mission of public health really is to work to ensure the conditions that promote health in our society, health and wellness in our society. And part of the problem is that it encompasses almost everything. Okay. And so it can be environmental health, it can be, our occupational health, our jobs, and how we're performing, and what characteristics help us to be well in the workplace. It can be, of course, our homes and the communities that we live in. It can be our physical health, it can be our mental health and well-being. And so it just encompasses so much of our lived experience.
Okay, great. So I was noting that last week, April the 1st through the 7th, was considered National Public Health Week. Yes. Okay. And one of the factors in particular, and I'm just going to read just a little bit of the data that I noticed, it talked about gun violence is an epidemic in America. Okay. And one of the days, Tuesday of last week, actually was devoted to the discussion of violence prevention. And as part of that, the data was like pretty alarming. It talked about the epidemic of gun-related deaths, okay, and how it has escalated since 2015, and that the U.S. had 27,400 homicides and 45,000 suicides. I thought that was really alarming, that involved guns. And some of the other data was that 1 in 4 U.S. women experience intimate partner violence, 1 in 6 has been the victim of rape or attempted rape, and hundreds of thousands of children experience abuse and neglect. And then it talked about how yet, violence is preventable. And so when you look at those statistics, what do you say about it? What is your feeling about how can we begin to deal with this issue of violence, in particular gun violence, which is obviously a major topic. But looking at this and how do we begin to deal with it in a way that's going to be we're going to be able to actually impact and reducing those numbers.
Yeah, sure. So, I think the data specifically around gun violence is just alarming. Like, we have tens and thousands of people who have lost their lives to gun violence each year.
Right.
And we can see that it's becoming more and more apparent that it is a public health issue. And I think it's important to know that public health professionals really need to push for federally funded research in order to transform these gun laws and to really help keep our community safe. And it's becoming more of a political issue now, and I think that's the biggest hurdle that public health professionals face in terms of transforming these laws and coming up with fact-based policies for gun laws. So that's my view on like the gun law epidemic.
Okay.
And you know, it's always sobering to hear all of the statistics, and you know, as Janine said, gun violence is a huge, significant public health problem, and obviously it was, you know, recognized as one of the leading public health problems in National Public Health Week that we celebrated last week. But you know, definitely, I think one of the things that we understand is all the different types of violence, and I think sometimes in the media or just when we're speaking about violence, you know, we kind of just put it all together and it's just violence. But I think what was great about the stats that you broke apart were, you know, thinking about, you know, interpersonal violence, death by suicide, also thinking about intimate partner violence and sexual violence and child neglect and violence. And so we see all the myriad of ways that you know, violent people experience violence in our country. And as public health practitioners, we have to really understand the differences between those experiences. And so I think as recognizing violence as a public health issue, we're able to treat it like every other public health issue. We're able to think about what are the risk factors, you know, what are the interventions that could be useful, what are the policies that are important, and they vary in all those different cases. And so that's why it's so important to really understand how do guns and how do violence influence children or elders, and elder abuse is very different than, you know, sexual violence or different types of violence. So it's so important for us to really understand those precursors and all the work that's being done to really understand and to fund research, to look at the role of policy, to look at the role of communities and all those social determinants that we know play a large role in the epidemic.
Okay. So having said all of that, and at LaSalle University in particular, so the program is a public health program.
Yes.
How does the curriculum that you have within that program really help the students to then, when they graduate, to be able to be prepared as health professionals then to pursue these issues?
Well, I'll kind of start off as far as the actual curriculum, and then we can hear from the student to hear about the student experience. And so, of course, we have an undergraduate and a graduate public health program at LaSalle, and we actually have a violence prevention class, actually. So we have a class that is dedicated. It's an elective for our graduate students, can take it as an elective. Our undergraduate students is actually integrated into their curriculum. And so every undergraduate student does take the class, and it's a great opportunity for students to be exposed to the different types of violence that are experienced by people in our country and globally. And so we have that great opportunity. We have lots of classes from intro to public health throughout, you know, social and behavioral health. And so all those courses really allow students the opportunity to think about social determinants of health, to think about risks, to think about, mental health and, wellness, to think about communities and think about vulnerable populations and things that put people at risk for certain types of experiences. And so we're really working to help students understand communities, to understand people, to also understand policies and interventions that could be helpful, to understand evidence and what that looks like, aside from opinions and antidotes. And so we really want our students to be able to go out and to make a difference in all the different, public health issues that we experience. But that can best be, I'm sure, described by our student to see exactly kind of how she's experienced the curriculum.
Yeah, so I'm in this program. This is my second year within the program, and what I've noticed is that it's very unique in the sense that there are so many different areas of public health, and we have to take a class in a lot of these different areas, whether it's biostats, health policy, community health, ethics, and it just really helps me to understand like how multifaceted one public health issue like violence could be, and how like there's so many things that we need to be knowledgeable in order to even think about how to combat one certain issue. So I think that's really essential for an aspiring public health professional like myself to understand before I even try and plan how I'm able to combat an issue or who I should collaborate with. I think that was something that I really understood as I got more and more into the program. And I liked how we started off with like the biostats class, because it really shows how important evidence is in sort of like changing an issue or even trying to promote change. So yeah, I've really enjoyed my time so far and learning a lot.
Great. So when we're talking then about issues such as gun violence, and I think, clearly in acknowledging, that it is an epidemic, something that you just said is understanding the different components, because I think people want to just say, okay, gun violence, okay, what do we do to get rid of the guns, okay, but to understand that it's not just that, but there are other components to that, and so possibly in looking at how we are able to begin to decrease this, then possibly maybe we should have public health officials as part of that conversation. I mean, absolutely. Public health professionals should definitely be a part of the conversation. And I think that's one of the great things about public health is it's so interdisciplinary. We recognize that we need policy, individuals who are experts in policy. We need educators. We need business people. We need criminal justice system. We need everyone's mental health and wellness, and we could go on and on and on. Every field, there's no field that is really not applicable. We can even go out to agriculture and thinking about architecture and space and how land and communities are physically designed. And so really we really need to look at all of that. We need to understand the breakdown in communities. We need to understand economics and employment and labor and housing actually also contributes to the epidemic. And so I think part of the difficult part is bringing that all together, and sometimes it's easy to just pinpoint that one thing and say, okay, we'll just focus on that, but understanding the problem is so much larger than that one thing. Okay. So and we know, like I said, the epidemic with gun violence, but another issue that has been in the news recently. I think every so many years it pops up, but it's really been ongoing. I think every day when I look at the news, I see something related to the issue of vaccinations, and so the issue is to vaccinate or not to vaccinate, right. And so what is your take on that as far as individuals who really honestly feel for some reason or another that it is harmful, vaccinations are harmful to their children, and so they opt out of that. And with the measles epidemic and the mumps epidemic now, where they were saying it was pretty much almost gone, now that's becoming prevalent right now. So how would you address that issue? or respond to those who feel that, you know, I can just opt out and it's okay.
I think from like a public health perspective, vaccinations have really changed the way we look at health. And if we think back from centuries and centuries ago when there were prevalent illnesses like whooping cough and smallpox and measles, and how vaccinations have really taken on the role of decreasing like death rates for those sort of illnesses and other infectious diseases. I think it's essential for children to be vaccinated, and you know, regardless of the controversy as whether or not vaccinations are harmful or whether there's a correlation between vaccinations and some other type of illness, or if it causes some type of illness, I think that shouldn't really be looked at, and we should really focus on how important vaccinations have been in enhancing our health. And I think the only problem with it is just figuring out what other vaccines we can develop to even enhance it even more.
Okay.
Awesome. I definitely echo what Janine said. I think, you know, as a parents are, you know, generally trying to do what's best for their children. And so when things are introduced through media or through, you know, different groups who are disseminating very anti-vaccine messages, it breeds fear. And, you know, once any parent, you know, once you have that fear, you're trying to act in the best interests of your children. If you don't have the knowledge and the history and the understanding of this is not, you know, this is historical. We have a lot of evidence. We have, you know, we understand what's true from myths or, you know, things that people have passed along. It introduces that doubt and fear into that decision-making process for a lot of parents, and they, you know, they've heard this, they've heard that, they're not sure what's true, and that doubt is enough to say, maybe not. I don't want to risk my child getting whatever, you know, they've heard, and not understanding the true benefits of getting it. And, you know, I would say that, unfortunately, there's a lot of anti-vaccine messaging that's going around, that's been going on, quite honestly, for the past several decades. And you're right, there's a resurgence every few years. And it really started off in the late 90s, where there was an article that was published hinting at the link between specifically rubella and the MMR vaccine and autism, I believe. And that was the only article that has suggested that since then the data was proven to be falsified in the original article. Most of the authors, co-authors, also have retracted their involvement with the article. The same journal has released a retraction of the research, and every single independent researcher who has tried to explore this has not found any association between vaccines and autism, or a plethora of other illnesses that have been studied in relationship to vaccines. And so we have this one thing that has been disproven and proven to be falsified, and proven that the original primary investigator was paid hundreds of thousands of dollars. You know, there's a whole thing there, but we still are like suffering the impact of this one thing, even though, you know, so much has come out against it. And so I think, you know, unfortunately, it just introduces that fear into people, not understanding the history and the background, not understanding the research, and that no other study has validated any association. I would say the Centers for Disease Control, they have a great site, and parents can watch a video and they can kind of learn FAQs to kind of, you know, it kind of takes parents through some of the questions they may have about what is a vaccine, what is it doing. You know, most vaccines at this point are not live viruses, you know, just understanding what a vaccine is. If you take a vaccine and your child gets a little sick, or, you know, there's soreness, or what that is and why that happens is different from, you know, you're suddenly at risk for, you know, something else. And so there is information that's reliable, embedded out there. And so I definitely encourage, you know, communities. I think this is where communities can be, we can engage communities better. to really kind of promote those messages around the benefits of vaccines and the danger, which is what we're seeing as far as the crisis, the danger of not vaccinating, especially when you have large groups of people that are not vaccinating, because there are people who legitimately cannot be vaccinated. There may be someone who has a specific type of illness who can't receive that vaccine, but they're protected, what we call the herd immunity. They're protected. If most of the community is vaccinated, then we're actually protecting them, right? It's like little doorways. There's only a couple of doorways for the virus to get in. We're kind of protecting them. But as soon as we open up all those doorways, the virus can get in and jeopardize everyone.
And that's what could kill them versus having had
that's much more severe.
And most of the what's called the childhood diseases are much worse when it's contracted as an adult. So it's also much worse as well. So that impact is. And does the American Pediatric, Association have information regarding as well?
Absolutely. You can, your healthcare providers, I would encourage people who, maybe have heard something to have a conversation, with their healthcare providers. Like I said, there's a lot of information out there, and I know it's difficult to sift between, the information that's valid. But, I think the Centers for Disease Control is a great site. Like I said, they have little videos on their site where, as well as FAQs for parents. Also, many the pediatric societies and associations, many health organizations also have statements and information for parents in particular. And so those are just great opportunities for parents to really learn a little bit more about what vaccines are. And I think, also recognizing what Janine said, part of the issue is that we haven't really seen these viruses in a long time. I mean, it's like vaccinating against something we've only heard about, whereas, a few decades ago, people had these viruses all the time. People were like, I don't want them, let me vaccinate. Now it's like this, we're a little removed, and so there's a little bit of like, oh, it's not that bad, right? I mean, it's just a little virus. So we're a little bit removed from experiencing the impact sometimes, and so sometimes it makes it easier if parents have heard something negative to say, oh, I'll just take my chances, versus understanding that these viruses are, they can be severe, and there are people for whom have very severe outcomes to these viruses, and so we don't want to just have them, out in the population.
Now you talked about a little bit, policies and how policies impact different aspects of public health, and we know that upcoming we have once again the election, so we'll have the deadline for voter registration, April the 22nd, but then the actual primary election in May the 21st. So once again, as we're looking at candidates on different aspects of politics, so to speak, what would you say about individuals asking questions of candidates, whether it's education, whether it's, whatever the other candidates are up for this year? How does that impact, since you're saying, you talk about how public health impacts so many different areas that people don't even consider or think about? What kinds of questions, or the fact that they should be questioning things that impact public health and policies in particular, what kinds of questions should they be asking candidates?
I think what's important is to understand what we're currently facing with, not necessarily what you want the future to look like, but handling the problems that are going on right now. And especially in Pennsylvania, that's the opioid epidemic, that's the Me Too movement. Those are the kinds of questions that people need to be asking their candidates, and to understand if they really have a good grasp of what's going on and how we are combating those sorts of issues right now.
There's so many issues, and I definitely echo. I think really understanding what we're facing, and I think public health practitioners can really help communities piece apart some of that. But I know also people in communities are also experts in their lived experiences and understand some of the pulls and the risks that are experiencing. And I can't help but remember a statement that someone was making just about the environment that some people are in, and really understanding, you know, those social determinants when we think about opioid, when we think about suicide, when we think about mental health, I think is a major issue, mental health and wellness, I should say, that we are just at the cusp of really addressing in a substantive way, which the trauma and the violence and the abuse that people are experiencing, but the horrid conditions that many people live in, not knowing where their next meal is coming from, not, you know, physically, their physical spaces are very dilapidated. So, you know, I think there's just so many issues that we really need to make progress on thinking about, like you said, what we're currently experiencing, and people being aware of the role of policies in those issues is really important.
I was just watching the news yesterday, and I know sometimes watching the news can be very depressing.
Yes.
But it was very sad to see in Pottstown where a 13-year-old who had been being bullied in school. And then I'm not sure how it came about, but these, you know, two individuals like literally came and shot up the house. So that the family, fortunately, no one got hurt. But, you know, the family, you know, the mother in particular was really, you know, livid and upset, and they had to stay away from their home for so many days, and then they finally caught the two who did it, 19-year-old. But, you know, as a result of, you know, this bullying is another big piece for whatever reason. So when you start to talk about, once again, you know, that's the whole, you know, that violence piece again, is that folks haven't learned how to deal with conflicts. Folks haven't learned, or they do it a different way, you know, and so it's kind of like now, you know, okay, I don't like you, you do this, just get rid of you, you know, so it's that mentality. And so, you know, as we're kind of winding up here, you know, it made me think about when you talk about what people are living through and the trauma, and I'm sure those kinds of things are going to stick, and I'm not sure that the what created the bullying has still been addressed at all, you know, so you know, so now will it be something else, and what role possibly can schools have in helping in those ways of helping students to understand how to deal with conflict, you know?
Absolutely. I mean, schools are an integral part of communities and neighborhoods, and, you know, children spend much of their day in schools compared to, you know, at home even sometimes. And so schools can be an amazing resource at helping, you know, to teach certain skills like conflict resolution, but also to provide services like mental health and wellness. There's a big push for trauma-informed services now, so that whether it's schools, educators, mental health providers, all service providers are approaching their services through a lens of trauma informed. And so, you know, for instance, instead of saying like, what made you do that, or why did you do that, you know, we want to say like, what happened to you? And, you know, we want to understand more about your experiences and understand that, you know, your experiences are a product, or your behaviors are a product of your experiences, and understanding, you know, what happened to you is a big part of that.
Okay, well, I thank you. Our time is up. But I thank you, Dr. Candace and Janine, for being here, representing LaSalle University, and being on our program. And clearly, we have a lot that we can still continue to talk about, but we appreciate the work that you're doing to help impact the area of public health. And so, as we close today, please visit us at our email, say @gmail.com, and please provide us your comments on our programs for today. And as you consider the things that go on in your life, take the opportunity to have your say. Thank you.